am a state senator representing Denver's District 32, and I am also a primary care internal medicine doctor. In my work as a state senator, I serve as the chair of the Senate Committee on Health and Human Services, and there's frequently discussion around what can be done to help us control our health care costs. So I thought, looking at how do we engage people in this discussion of health as opposed to sickness care and get them to be part of the conversation, since ultimately most of the power is in their hands. One of the ways in which we need to put a lot more thought into is how do we get people to engage in physical activity. So certainly when I speak with patients, I talk with them about the need to exercise, and I emphasize that sometimes people think exercise and they think you're lifting weights or you're on some fancy machine. And I emphasize that if all you do at home is sit around, exercising is taking a walk for 30 minutes. One of the social determinants of health is education and income and poverty and environment. And I was at a meeting last night about the Globeville-Swansea-Elyria neighborhood and a health impact assessment that had been done on them. And I think we forget how important the fact that there aren't sidewalks, the fact that there aren't parks, the fact that the lighting is not good enough for people to feel safe going out at night, and the impacts those have on people living in poverty. I think there's a lot of discussion about we need people in poverty to take more, responsibility for their physical health, and we don't realize the systemic environmental things that exist that make that harder for them. In the past 2 years, I think this awareness has even come to me more as a physician in terms of prevention, spending more time talking to people about the concept of physical activity and really making it as non-threatening as possible.